Lindsay, thank you so much for joining us here today on APTN InFocus. Now, we've touched on the incident with Joyce Echaquan a couple of times throughout the show. So my first question for you is, can you just remind our viewers who Joyce is and what happened to her?
Yeah, Daryl, of course. So it's a very complicated story, obviously, with many overlapping factors. All of this unfurled over several weeks during a coroner's inquest. But to boil it down to the most basic facts, this is what you need to know. Joyce Echaquan was a 37-year-old Atikamekw mother of 7 with numerous compounded health issues for which she was receiving treatment at the Joliet Health Centre about 2 hours outside of her home community of Manawan. Now, it's an institution that community members are very familiar with. Unfortunately, there is nothing actually closer for them. So Joyce was there complaining of pain, hoping to receive some attention from the healthcare workers that were tending to her that night. She was labeled belligerent and difficult by the people who were tasked with her care. She was sedated, she was restrained and in extreme pain, and in her dying moments was able to reach for her phone, hit the live button on Facebook, and capture the moment when her caregivers were actually heard hurling racial slurs towards her, calling her effing stupid, saying that her kind is only good for sex. Really appalling things that in no circumstance would have been pertinent to her care or just appropriate in that moment. Back home in Manawan, her husband, Carol Dubé, was notified by neighbors about a Facebook Live video that had gone up. And although in that video, towards the end, we do see the healthcare worker take the phone from Joyce, stop the recording, and later find out that she tried to delete that video, by that point it had already circulated on social media. The community was already abuzz with the news that something had happened to Joyce at Joliet. The circumstances at that time were pretty unclear, but the video circulated internationally, inspiring calls for change, for healthcare reform, and ultimately the repeated message, to which to this day is justice for Joyce.
Mm-hmm. And Lindsay, you mentioned the Facebook video and sort of the repercussions from that. Now, you've covered this story from the start. So how have her videos or the video impacted the narrative of racism within the healthcare system?
Well, the coroner, who spent several weeks, hearing testimony from all sectors, all people who were involved in Joyce's care from the Regional Health Board, she actually infamously concluded that Joyce would likely still be alive today if she were a white woman. And I think across the board, from politicians, from community members, everyone agrees that the treatment that she was receiving was inadequate, that the racism that she was subjected to was unacceptable. But in the political sphere, this has become kind of a game of words here. The community says that Joyce was a victim of systemic racism, something that imbues all tiers, all sectors of Quebec society, and the Quebec government in turn denies the presence of systemic racism. They say they disagree with the definition. They understand systemic racism to be systematic racism, and they don't think that our healthcare system was created with the sole intent of subjecting Indigenous people to racism. So this is a back and forth that continues even to this day. It's an agree to disagree situation, but although we haven't seen any other very flagrant examples of racism like what Joyce experienced, it has actually opened up conversation to other sectors and other ways that First Nations and Inuit communities are underserved by the health and social services sector. So that could be in terms of, having things closer to home, having employees that are culturally sensitized, having adequate transportation to and from quote-unquote remote communities. So that conversation continues while the stalemate over this idea of systemic racism still continues and persists.
Mm-hmm. And Lindsay, you had mentioned sort of the both sides of the argument, if you will, with the community and the government. So you touched on the reaction of that, but maybe I'll ask again about the reaction from the community and the governments, and maybe where they stand on everything sort of going forward. You said it's sort of like a stalemate, if you will. So what's sort of the two sides saying, and what's been the reaction from both sides as this has sort of unfolded over the last number of months?
Well, the community mobilized very quickly, and even days after Joyce's death held a large-scale demonstration and vigil outside of the Joliet Hospital. So that was the first sort of push for community action. And after that, they undertook quite a lengthy consultation process with other Atikamekw communities, with First Nations stakeholders in general, to kind of back up and take a macro look at the healthcare system, to talk about the concerns, to talk about the historic issues there, the lack of goodwill, and also how the pandemic has sort of compounded the resources that are available, how it has in fact strained the healthcare system to a very severe degree. So all of these ideas, these suggestions have come together in the document that they've called Joyce's Principle. And Joyce's Principle was acknowledged by the House of Commons. It's been acknowledged by the United Nations. Almost everybody except the Quebec government has really given the stamp of approval and said that this is a viable plan for healthcare reform. Quebec, like I mentioned, will not adopt it in its entirety because it calls for recognition of the contributions to systemic racism, which they don't feel exists. So essentially, Quebec took that document, said thank you for the ideas and thank you for the work and the consultation that you've done, but we're going to do our own thing with this. And so that's what we are currently waiting for right now, is to see whether or not Indigenous peoples are going to be protected in a healthcare context through better laws, better policies, more funding. So unfortunately, it's a long-winded process, and we're inching closer to progress, but there's no clear idea on the horizon for when this will be resolved completely.
Right, and you've certainly given us a lot of information so far, but I guess I'll sort of ask what the latest is. Some of what you just said, it sounds like, was sort of a wait-and-see game. So what is the latest here with Joyce's story?
Okay, so well, community members and Quebec Native women were actually just recently at the National Assembly to push again for adoption of Joyce's Principle, recognition of systemic racism. But the Quebec government insists that this recognition is not preventing them from taking action in other ways. And to their credit, they have taken some steps to correct or amend this issue. They've made space for more Indigenous representation on the regional health boards. They've funded the opening of an Indigenous healthcare clinic operating in Joliet, which is supposed to open doors in 2025. And they've also implemented mandatory cultural sensitivity training for all public healthcare sector employees. The thing is, I've spoken to some healthcare employees who did not want to go on the record, who explained to me that they are in fact facing pressure from management to sort of speed through the training, you know, maybe not take it as seriously as it's intended to be taken. And we've been unable to get confirmation from the health ministry to find out how many healthcare workers at this point have completed this mandatory training, and if they haven't, what kind of punitive measures or sanctions they might be exposed to. So that's still a bit of a question. Quebec, after the pandemic, also introduced some amendments to their health and social services law. The community was hoping to see the right to cultural security really enshrined in that piece of legislation, and were disappointed when it was not included. But our Indigenous Affairs Minister is promising that that will be subject of its own law that is supposed to be upcoming. We spoke to Joyce's widower actually a few weeks ago, and he said he heard some murmurings that there might be a presentation made in June. We've been unable to confirm that information. But meanwhile, he's undertaking his own steps towards healing. He just undertook a 3,500-kilometer skidoo journey with an ensemble of First Nations communities to really raise awareness of this issue of systemic racism, and to try to get, you know, the ensemble of Quebec society on board to push the government for this recognition of systemic racism. And it's not a fight they're planning on giving up anytime soon.
Well, it's certainly a lot to think about and a lot to look forward to, Lindsay. And just before we let you go, I wanted to ask, like I had mentioned, you've been on this story right from the beginning, and one of your stories, it actually had the home videos of Joyce Echaquan, and I just wanted to ask, one of the questions I'd asked previously was who Joyce Echaquan is, and I just wanted to get your thoughts on those home videos, and maybe for our audience, what those videos meant.
I remember going through those videos and getting quite emotional, to be honest with you. Joyce was a doting mother. She was extremely close to her children. She was a new grandmother at the time of her death. and very much a do-it-yourself documentarian. There were no moments in her life that she didn't feel were worth documenting. So her Facebook page is just rich with these images of her laughing with her children, or eating food at a mall, or just being in love and alive with her husband. And she was a woman who could have had a lot of years to go, and whose absence is very much felt. But for her children, for Carole, her widower, I think those videos are a lasting testament to what an incredible person she was, and not the person that we heard about during testimony during the coroner's inquest. She was labeled as narco-dependent because she used prescription pills that she was given by doctors during other visits, labeled as difficult, as a frequent flyer in the hospital system. So I think those videos are very important to sort of ground us in reality and remind us that there's very much a human attached to these principles and policies that we're fighting so hard for at the highest levels of government.
Yeah, it's really well said, Lindsay, and we'll have to leave it there, but thank you again so much for coming on. I know you and the team in Montreal is always hard at work on such great stories and great things. So again, thank you, Lindsay, for coming on and sharing a bit of info with us.
Always a pleasure, Daryl. Thanks for having me.